Come on. Whoever's going to speak on behalf of the Controller's Office, and I think we also have LAFD representatives here. Do I have Chief Takashita? Are you coming? You want to take a seat at the table, and then we also have Captain Quinn. Good afternoon. I think everyone's got a mic. Okay, we'll start with the Controller's Office.
Okay. Cynthia Varela with the Controller's Office. From July 2010 through June 2014, the city spent more than $800 million on workers' comp benefits. This includes medical cost and permanent and temporary disability payments. During the same period, employees filed almost 29,000 workers' comp claims. Sworn employees in both the LAPD and the fire department file more claims than any other city department. And though many workers' comp expenditures are beyond the city's control, the best way to limit cost and maintain a safe and healthy workforce is to prevent the injuries and illnesses before they occur and result as a claim. That's kind of the background to set the stage as to why the Controller's Office conducted these two audits. The first audit, we conducted a review of the fire department's workers' compensation prevention program. The report was issued March 26, 2015. The overall objective of the audit was to assess the fire department's efforts to minimize workers' comp claims and related costs and to identify potential causes of the claims, including strategies to prevent injuries, promote safety, and encourage employees to return to work. Our audit reviewed activities primarily over a 3-year period ending on June 30, 2013. For some context, we updated some of those figures for background to include the more current fiscal year, 2013 through 2014. As part of our overall assessment, we noted that LAFD addresses many aspects of firefighter safety. However, it lacked an operational preventive injury and illness program that focused on workers' compensation. We found that LAFD had not employed a comprehensive effort that identifies the potential causes of injuries and resulting claims in order to develop strategies to prevent future injuries and related claims. The key issues noted in the audit included that the department had not adequately established or operationalized its injury and illness prevention program. The impact of injury prevention on workers' comp claims and costs were not clearly defined as priority objectives, and there was not a clearly stated department-wide focus on reducing workers' comp injuries or costs. While the department thoroughly investigates, evaluates, and reports on injuries that occur during fireground operations, these practices did not extend to other types of injuries that result in workers' comp claims. The department's culture was not focused on reducing the, claims that arise from workers' comp injuries. Secondly, the department's risk management activities were not focused on assessing workers' comp risk. We found that LAFD had not captured sufficient detail regarding injury causes and other trends. For example, we noted the description of certain injury causes was too broad to be useful, such as structure fires or emergency medical services. And if LAFD had implemented a plan to reduce the number of new claims filed by as little as 2%, it would have reduced workers' comp costs by an estimated $483,000 annually. Next, LAFD did not have a fully functioning safety committee. Without a fully functioning safety committee, the department lacks assurance that changes to equipment, clothing, and other items are based on sufficient research and study, and changes may not be based on the department's actual experience with accidents caused by equipment, clothing, tools, or other apparatus. Lastly, LAFD did not have a mandatory fitness standards or comprehensive fitness and wellness program for all active firefighters. The department had recently implemented a new fitness program, Functional Movement Screen. However, that program is for new recruits and not active firefighters. We noted that other fire agencies experienced a decline in injuries, time off due to injuries, and cost after implementing wellness or fitness programs. As far as the department's response to the report, they had submitted an action plan for implementing all 19 audit recommendations. Based on the department's action plan at the time of the report issuance, we considered 5 recommendations to be in progress or partially implemented, and 14 is not yet implemented.
Do you have something, you with the Controller's Office as well? Mm-hmm. Did you have something to add?
No, I'm here to help if there are questions.
Oh, I see. Did you want to respond? I don't know who wants to start first. Do you want to start first?
I'm Robert Takashita. I'm the battalion chief assigned to the risk management section. Accompanying me is Captain Scott Quinn. He was part of the controller's audit, that year-long audit at the risk management section, so that's why he's here to accompany me for specific questioning. The fire department agrees with the findings from the controller's office. At the time of the publish of the audit, there was 5 of the 19 recommendations that have been implemented or in progress. Currently, right now we're at 14 of the 19 recommendations that are partially or implemented within the audit recommendations. Some of the current challenges the fire department faces, again, is staffing in dedicated positions, funding, technical support, data management, and then also labor agreements to help complete the audit recommendations. So that's all I have.
That's all you have. Do you have anything else to add, Captain Quinn?
At this moment, no. I'm just really here to support any questions that may follow through.
Okay, we have one speaker card, but did you want to? We can start with questions first. Do you want to?
Sure. You mentioned 14 of the 19 have been done. The 5 that haven't, is there, what's the reason for those? And is there 1 or 2 that are difficult and that you do not intend to implement?
At the moment, the 5 that we have, there are 4 that are prioritized as a Category B and only 1 that's a Category A prioritization. We're searching after the Type A or Type A categories first. The limitations on some of these are we need a great deal more data to identify the best strategy and tactic to improve that particular section or that recommendation.
Or you'd be more specific. Which recommendation are we talking about, and what do you mean?
The ones that have not been implemented at this point are 2.1, 2.2, and 2.3.
I don't have it in front of me. So they're saying, what are they about? I have them, but
well, in very short order, they have to do with establishing goals and a risk management policy. That's the spirit of the 2.1s. Part of that comes down to funding a dedicated staff. We are working towards that. It's just we try to take care of the easier fixes first. As we implement the first or several of the recommendations, I believe they're going to be a footprint and give us more data to drive our risk management policies on the back end. One budget recommends giving the safety officer a dedicated budget for itemized spending and procurement of tools and equipment to run trial programs and a variety of things. That's a revenue source that really doesn't exist in our already challenged budget. And that 2.3 is consider having a safety officer and risk management responsibility assigned to 2 individuals at the command level. Currently, these responsibilities fall under 1 commanding officer, which is Chief Takashita. It would require a new position, funding for that staff, and then a department reorganization and adoption of that position. We have to take that to top staff for a recommendation. And then the 6.2 is consider designing training based on evaluation of illness, injuries by age or years of service. And the way that our department is set up, we need to drive that data down a little bit farther to really find out the types of injuries that are occurring in the age groups based on time of seniority, based on placement and assignment, whether these injuries are presumptive, whether they're covered under California Code, Labor Code, whether they're based on cumulative trauma. We don't have sufficient data to adequately address 6.2. And then
are you collecting that data now, or?
Our databases are designed to take care of the welfare, actually capture the injury, get the member treated, get them back to duty. The other side, personnel has an IBOS system that is designed, which is more or less the payment side and the cost related. We need technology that allows these 2 platforms to talk together to give us specific data. We realize that there's far more information that we can capture to create, policy and training and education specifically for certain areas. We have a thumbprint of what we believe our injuries are that are occurring, but we really need to address that particular recommendation to make a fair and appropriate tactic and strategy to
If I
achieve
can
it.
jump in really quickly. So are you saying you're not currently using IVO, so the medical, what is it called, medical liaison unit database? You have access to both
We have
databases.
access to both.
So do you currently use them?
They both provide data that's slightly different than what we're looking for in this room.
So it's not specific to what you're looking for?
Not yet.
I was wondering if you were using either one of them to try to develop a specific training topic to try to start preventing some of these injuries? So they're not useful to you?
They are useful to us. We have to find a way to get the technology to talk to each other.
Okay.
We are currently looking at pro bono partnerships with technology to find a way to get these data systems to talk to each other. We do know that we are trending significantly with back injuries. We have an online back safe lifting program. We are looking at ways to minimize that through tools, equipment, and training. There's a lot of influence on what can cause a back injury.
Council Member Martinez, this is Will Newman with the Controller's Office. Captain Quinn is describing the MLU system as a system that it was really designed by, I believe, a firefighter, not a systems person, to help them deal with data that was coming in as the injury to a firefighter occurred. And it was to help them produce forms and get the person treatment and so forth. It wasn't designed to capture the detailed information of what, when, how, who, why, specific to diagnosing in great detail what's going on. We live in a world where the data now is ruling.
Right.
And so, as we described in the report, MLU...
This is more to file a claim.
Right.
And to get you the medical treatment that you're going to need to treat the injury.
So the issue here is that the detail, when it says in the MLU structure fire, there could be 5 more fields on the north side of the building and this and that. And it is true that they need to interface, they need to do this high-level stuff. But by adding a few more fields, 2 or 3 more, they could add detail that would be of great value to them in this regard.
And I appreciate we're working off each other. So what does it take to get that detail, those fields added into the report?
Have the firefighter come back that designed it.
Is he still with us?
I don't think so.
No, we're borrowing staff from our Management Information Systems group to actually help streamline our current system. But she's dedicated strictly to the EPCR system that the city has been integrated into. So getting her full-time would be a huge asset in terms of identifying data to help identifying goals and objectives. But right now we have no technical staff.
But just to tweak that database, to add those fields, I mean, ITA, someone, I'm sure that someone in the city could make that happen, right?
A little bit of the heartache is that system's kind of archaic. It doesn't allow us to do tag-type research. We kind of need to step forward into the future and employ a program that will give us specific data that can build all this out to a much better level. We believe that the data is going to improve our operational effectiveness, improve our budget and bottom line. It just doesn't exist within the fire department yet. We're seeking options.
Yeah, I mean, I think we certainly want you guys to get out the best option, maybe work with ITA, but it just doesn't seem... It seems like there should be stuff off the shelf these days that you could, have this kind of data be part of. And then I don't want to presume to say that, but just it warrants looking into and maybe consulting with ITA. We have a lot of folks who are doing this same kind of thing for other agencies throughout the city.
We agree, sir. We have adopted a fire stat type concept, which is trying to identify operational performance and kind of a measure of effectiveness operationally in all of the bureaus of the fire department, and it's reached into our shop. Just everybody's competing for the same resources. This is one of those items that we have an idea where we need to go. It's just going to take some time to fully implement it and develop it.
Okay. Different line of questioning. Mm-hmm. The neighboring jurisdictions, and maybe this is for the Controller's Office, have fitness and wellness programs, and when they do, they see a decline in injuries since they've been implemented. And I know that after the budgetary issues, LAFD discontinued medical evaluations, the wellness program, mandatory fitness standards. Did we see any change after that was discontinued? Did the audit find that there was a difference in the number of claims after the elimination of that program?
I think if we just look at the graph at the beginning of the report where it shows the upward trend of workers' comp claims, that covers the 3-year period that we looked at. The elimination of the wellness fitness initiative occurs in there, but I don't know that we saw a spike. The Dr. Loy that used to be employed by LAPD was some years ago before our audit scope, so the loss of the wellness fitness person, I don't know the exact date, but
Yeah, I can't.
I don't think I could comment on that without doing some additional research.
How much would it cost to initiate a fitness and wellness program? Or implement it, I should say.
Well, currently the department, we have work groups working on those specific items. One is the medical evaluation or annual evaluations. We're working with our current labor, our UFLAC group, regarding having the city work and pay for the unpaid portions of the medicals. So we're currently working with our labor and labor group UFLAC on that process. Also identified within that same group is working to develop a wellness program. So we are currently in the process of doing those two things.
But do we know how much it would cost to implement one? What did it cost when we had one?
Some of what we had in the past was a grant subsidy
Oh, I see.
that we
that's
either
all
was not
gone away.
applied for or has
Gone.
expired.
Or related how much it would save, in the sense that, I know that we've seen some statistics, you guys had it in the report about other departments that have that, where they had substantial savings in workers' comp, and I'm presuming that the savings would offset the cost, but only you guys would be able to know that.
We've been working with LA County, their battalion chief in their work comp section, and he actually pointed out that if you look at one of the benchmarks, it shows that LA County is actually trending higher in terms of their work comp injuries. Per 100 claims, LAFD is at 37, LA County is at 45, and Orange County Fire Authority is at 43. LA County and Orange County Fire both have the fitness programs. So we're actually trending lower without a true fitness program. So we expect to see those numbers if in fact it does substantiate a fitter firefighter, lowers work comp claims and costs, we should see that number going down once these programs are initiated.
Right, and there could be many reasons why others are trending up, that they're not focusing on actual prevention, which is why we stated in the report when they had implemented this, what they saw at that period of time as far as a reduction.
I would challenge that assertion that their trends are not reflecting the results of the Wellness Fitness Initiative. In the research that I did and we did in our office, we saw dramatic results. So to hear that doesn't sound correct. Not saying that they're not saying the truth, they're saying something that doesn't fit with the data that we saw. And maybe there's an interpretation issue where we would have to maybe talk to each other and agree that, oh, yeah, because I would say that based on what I saw, that is not correct.
Well, of course, we want to try to sort that out and see if
I'm just going by the statistics that were provided in the benchmark. But also in talking with Chief Cruz from LA County, definitely they do have the We Fit or Fit for Life programs initiated, but it doesn't explain why they're trending higher in terms of their work comp injuries. And I just wanted to point those two facts out in terms of the benchmarking.
And then sports injuries. I know that related, they're 13% of all the claims, or 1.3 million in workers' comp and 2 million in overtime. Has the committee or the work group established, recommendations on how to help prevent those related injuries?
One of the unfinished business was the injury illness prevention program. I think the spirit of this whole audit is to prevent the injury before it even occurs.
Right.
That's the greatest cost saving that we, as an agency, can have the control over. That is in near ready for publishing. We have a committee that is working on a injury prevention and investigative procedure. In the event that we have a sports-related injury or even a fireground injury, that is going to be investigated. Based on the contributing factors, it's going to be followed for a length of time off, how we can get the member back to work, get them on light duty, perhaps find a place for them. And if it's related to If we have repeat offenders, we're going to look at restriction policies. We're going to look at a variety of things, education, an educational campaign, let the membership know how this impacts the budget of the city. We have a couple of ideas on the table. We meet one more time next week in which we hope to come up with a policy, I would think, maybe midsummer. Some of these have to be vetted through labor and firefighter bill of rights and, of course, patient privacy and confidentiality.
I thank you, Mr. Blumenfield. Can we talk about item 4? I'm sorry, I go by item 4, but it's finding 4. Has the department hired the injury prevention coordinator yet?
Currently, risk management and MLU have seen reduction in staff. And
So you haven't hired?
there has not been
Okay.
a record.
So who currently researches the data and the caution and the trends related to workers' comp in the department?
It's every injury comes in, it is manually entered into a chart that's evaluated till we get the technology to do it better. We have a system that was developed within ITA. It's called the 5020 system. It's an electronic injury reporting process. It has supervisory levels in it, and its full design is to allow some investigation, supervising investigation to an injury or illness that has occurred. That is able to provide us data. We still need to tool it to give us specific data that we're looking for. So right now we're trying to accomplish all these things.
So this is a budgetary issue?
It's a budgetary issue.
All right. On finding number 5, do you find that employees are discouraged from expressing their concerns because the existing process isn't anonymous?
My current position is the Department Safety Coordinator, the Cal OSHA liaison,
Uh-huh.
and I investigate all fireground injuries. I find that people are actually very forthcoming with information.
Okay.
I believe there would be a benefit if they could do anonymous recommendations. We do have an email address. They can write it. They can mail it.
Kind of like a suggestion box?
Sure. We have a Form F-100, which is a suggestion. It's probably
What is
underutilized.
it called, the form? What is it?
An F-100, and it's really any person in the fire service is allowed to submit a suggestion.
Okay. I was interested in what your opinion was about that.
I have a safety tab on our informational portal. That portal is being reconstructed, modernized a little bit.
Uh-huh.
I hope to have a tab on there where they can enter some information.
Okay.
So we agree with finding number 5. I think it's a good idea. We'll as the timing and the technology is available, we'll enact it.
Okay. And going to finding number 8. So here is it really feasible for the department to implement a safety management system department-wide? Because you haven't done it.
We haven't done it. We are trying to fully understand a safety management system. It's two things. It's a philosophy and it's a process. It works in areas like our air operations where an accident can have deep consequences.
Right.
And they are safety-minded, much like we are in the fire ground. We need to find something that rules the everyday operations of the fire department. So we just, since the publishing of the audit, we haven't had time to design more than a strategic plan of accomplishing it.
Okay. And we talked about finding 10, so I don't have any other questions about that. But in finding number 9, have you improved the training record keeping in your learning management system?
Yes, we have. We utilize a learning management system which is contracted through Target Solutions, and it's the center point where all of our training goes. Paramedics, EMTs are required to have continuing education. There's seasonal training, such as brush fire awareness. There is mandatory training, such as first responders. All this platform has all of the training criteria on there. There's for instance, we believe that backs are our leading injury. There's a safe lifting procedure on there.
And
Now
what's the percentage of your sworn employees who have actually taken the required safety training?
I don't have, I haven't researched that audit. It's,
Can you get that to us?
yes.
And then my last question is under finding 11. Have you established the committee and the work group? I know you mentioned there is a work group that is currently looking into, we talked about it earlier. I forgot what we mentioned, but have you established a committee or a work group?
We have established a committee and a work group to evaluate sports injuries.
Okay, that's what I got.
And
Sorry, I
we,
remember you said that earlier.
we are at the immediate direction of the Fire Chief Terrazas to come up with a department of bulletin that addresses this and how, how we can improve on it.
Okay. That's all I have. Do you have any other questions? Well, thank you very much. I think we're going to have to clear the mics because I do have a card from the public that I have to take, but thank you very much for your time. Thank you for being here. We have one card, Madam Clerk. Mr. Frank Lima.
Good afternoon, Honorable Chairperson Martinez, Councilmember Blumenfield. As you know, I'm Frank Lima. I proudly serve as the President of United Firefighters of Los Angeles City at UFLAC, and we are committed to reducing workers' compensation costs in the City of Los Angeles. Having said that, I must point out that the audit paints a very incomplete picture of the work of our firefighters and the real cause of these workers' compensation claims. Just last night, we had a firefighter injured driving Code 3 near Granada Hills High School. And early this morning, we had a firefighter hurt at a commercial fire. You don't hear about those things, but you cannot have a discussion about the LAFD and our firefighters without first mentioning that we continue to be the most understaffed big city fire department in America. Last year, our members responded to more than 414,000 emergency calls for service. We did this in a department that is down approximately 500 net firefighters from just a few years ago. Our members are continually being forced and compelled to work 24-hour shifts at a time of overtime. This situation and waves of extra hours worked, is a critical factor in the workers' compensation stuff. We have a very physical job. We're lifting heavy objects. Elevators are broken. We lift patients downstairs, jaws of life on the hillsides, 200-pound ladders. And when you combine one of the busiest fire departments in the nation with these kind of calls and the most understaffed, this is the formula that you get. When our department was fully staffed prior to 2008 cuts, we didn't have a lot of workers' compensations problem like we have today, but the word that's not used and brought up is cumulative trauma. I know you're aware of. If you ask Muhammad Ali which fight did he get hurt in, nobody could tell you because it's continual pounding, and that's like our job over a course of a career. As you know, we have presumptive loss such as hernias, and it's not tied to one incident. So for the controller to disingenuously try to say that our injuries are not connected to structure fires is disingenuous at best. It's cumulative trauma. And I'd like to see the audit by our controller that focuses on our staffing issues, our lack of fire stations, and the fact that our members still get the job done every single day in some of the busiest communities in the city. Thank you.
Thank you, Mr. Lima. Madam Clerk, there are no more cards on this item. If there aren't any other questions, Mr. Blumenfield, no more questions? Then with no objection, I'd like to note and file item 1. Okay. Madam Clerk, can move on to item 2.
For item 2, the controller has submitted a similar report or audit of the Los Angeles Police Department's Workers' Compensation Prevention Program.
Do we have someone from the Controller's Office? And I believe there's also LAPD representatives here. Police Administrator Francois Gardere. Did I pronounce that correctly?
Francois Gardere.
Ooh, that sounds a lot better. Personnel Division and Captain Dominique Choi, Risk Management Bureau.
Yes, ma'am.
Welcome.
Thank you.
And we can start with the Controller's Office. Go ahead.
Similar to the audit that we did on fire department, we performed an audit of the LAPD Workers' Compensation Prevention Program. This audit report was also issued March 26, 2015. Again, the similar objective of the audit was to assess the police department's efforts to minimize workers' comp claims and the related cost, and to identify potential causes of the department's claims, including strategies to prevent injuries, promote safety, and encourage employees to return to work. Our overall assessment found that while LAPD addresses certain aspects of officer safety, specifically traffic collisions and the use of force, it lacked an operational preventive injury and illness program that adequately focused on workers' compensation. As a result, LAPD had not employed a coordinated, comprehensive effort that identified the potential causes of all injuries in order to develop strategies that would prevent or minimize future injuries. This contributes to LAPD's inability to minimize the cost associated with workers' comp claims for medical care and temporary and permanent disability benefits. The 9,377 claims opened from July 2010 through June 2013 amounted to $140 million through October 2014, and the cost of these claims will continue until the claim is settled. While police officers have dangerous jobs, many work-related injuries and illnesses may have been prevented. In a sample, we found potentially preventable claims amounted to 40% of the sample's cost. If LAPD implements our recommendations and can prevent a significant number of workers' comp injuries or illnesses, there can be significant cost savings to the city. Some of the key findings that we noted in this audit was that, as I mentioned, they hadn't established a comprehensive centralized injury and illness prevention program. Management had not created an environment at LAPD that prioritizes preventing and minimizing workers' comp injuries, nor encouraging reducing injuries and encouraging employees to return to work. The culture of LAPD has played a part wherein 60% of the sworn employees filed at least one claim during the audit period, and employees having more claims, and the department having more claims per budgeted employee than 4 out of 5 surveyed agencies. LAPD had not adequately implemented a workers' comp risk management plan to address the causes of preventable injuries or illnesses. Many of the injuries and illnesses could have been prevented, but LAPD has not utilized or developed adequate information systems to identify the causes for those injuries or illnesses. We estimated preventable injuries cost $6 million per year. According to the Personnel Department, the need for a risk management system was identified 7 years ago, yet the city still does not have a system to help identify and mitigate preventable injuries. We noted safety committees were not operational at all divisions to help address workplace conditions. LAPD had not implemented effective procedures for monitoring an employee's return to work after an injury. LAPD does not have mandatory fitness standards for officers beyond the police academy when they're recruits, and other than for those in specialized units in the Metro Division, such as SWAT. Lastly, LAPD has not clearly defined policies for department-sponsored athletic activities and events that are approved for workers' comp coverage. 4 out of the 5 police departments that we surveyed do not allow on-duty sports activities. Of the recommendations that were directed to LAPD, there were 26 recommendations in the report. 23 were directed to LAPD. 1 was to the Personnel Department and 2 to city leaders. Based on LAPD's formal response that was included in the report, of the 23 recommendations, we consider 1 implemented, 19 were in progress, and 3 were not implemented. Just to note, personnel's response did not provide a definitive action plan, so we considered it as not implemented.
Okay. Do you want to start?
Yes. Good afternoon, committee members. I'm Francois Gardere. I'm in charge of personnel and recruitment for LAPD. With me is Captain Choi. He's in charge of the risk management division. We have created a strategic plan to implement most of the controllers, if not all of the controllers' recommendations, and we'd be happy to answer any questions you have at this point.
Okay. I have several questions. Did you want to start, Mr. Blumenfield?
Sure. On the last point first, you said plan to do most, if not all. Is there any particular ones that you're not intending on implementing of the audits recommendations?
There was one recommendation regarding the 180-day implementation regarding sending injured employees home after, made a mistake on that. When an employee is injured for longer than 6 months, they may be transferred to Personnel Division for administrative purposes. Right now, that is not a must, it's a may. And we concluded that it should remain a may because we should not force commanding officers to send those employees to Personnel Division for administrative purposes because there may be some sort of circumstances under which they would better handle that employee's administrative issues.
So that's the only one of the recommendations that the department is not planning on implementing or is not in the process of implementing.
Were there any others?
I think direct reporting to the mayor's office, we believe that's going to be, by and large, a function of the personnel department's role, although we are liaisoning with them frequently and in touch with Dave Noltemeyer over there about IBOS and a bunch of other worker compensation issues.
Explain that again. That's about...
There was a recommendation that to manage some workers' compensation prevention efforts, that our department, LAPD, should report directly to the mayor's office and city councils as far as, let's see, as far as our reports or status updates, things like that. We believe that personnel department has that information out of IBOS to report to the mayor's office directly or city council.
Do you think it's being handled, doesn't need a separate track, and the controller has a different opinion on that?
Right. I mean, the controller's office looks at it as each department is responsible for having plans in place to mitigate their workers' comp claims. They're really the first stop. Personnel department is actually more on the claims administration piece of it. Once an injury has occurred and the claim has been filed, then they're making sure that all of the legal mandates are being followed and that payments are going out as they need to. But from our perspective, we feel the thing that's really going to have an impact on reducing workers' comp claims is if departments start reporting directly to the policymakers and indicating what they're doing to try to prevent those claims. What are the statistics looking? What are the injury trends that are looking at? And how are they addressing those? So we really see it as it's more of a department responsibility versus personnel once the claim gets filed.
Yeah, that's actually a 1.2 in the recommendations, and it does mention prevention efforts and the results of corrective actions, which wouldn't necessarily be something that personnel department would have.
So you're saying those things should be reported directly to the council and to the mayor?
Yes.
But you're saying that that's not the intention of the department to report directly?
No. At this point, no. That obviously can change.
Okay. Well, that's something we may want to, it's a policy question. I mean, off top of my head, it seemed that it would make sense to report directly to the council. I don't see how it hurts. It could only help. So I certainly would want us to either, move that further into a policy question for us to deliberate on, rather than us deciding. But it's important to highlight that. So I appreciate that. A couple other questions on the for the department and then for the controller. In response to finding 2, LAPD responded that their risk management division was contacting organizations in Cal OSHA's voluntary protection program who were recognized for outstanding health and safety. In the 2 months since the audit, has there been any progress on that front, or have any other steps been established?
I'm not aware of that recommendation. Recommendation 2?
To finding 2, it's my understanding LAPD responded that the Risk Management Division was contacting Cal OSHA's Voluntary Protection Program.
Department response.
What's that?
It's department response to 2.1.
Oh, I'm sorry. So what we've done as part of our risk management and harm reduction strategy, which encompasses workers' compensation as well, part of that strategy is to develop problem-solving teams. And one of the problem-solving teams addresses workers' compensation or worker injury. of all sorts. That team has reached out to Cal OSHA for best practices, kind of getting educated on some of the minimum mandates and additional things that we can do to prevent these injuries from occurring. We've also reached out to not only Cal OSHA, but a lot of other companies, such as today the team went out and visited UPS, their safety committee. They're meeting with Toyota. They're meeting with all kinds of experts in the industry to push out some best practices within the department to hopefully reduce our worker injuries.
And has anything, at this point, has anything besides just gathering information come of that?
We've identified some area, well, part of our strategy, our harm reduction strategy, is to identify specific areas that we can focus on solutions, interventions, and we've identified some of those. Without getting too specific, one division has significant injuries in the weight room. So we're meeting with that command officer, looking at those injuries, trying to determine a root cause, and then get an expert team together and develop a solution so those don't repeat themselves, so we prevent that from happening. And that's kind of the basis of the whole harm reduction strategy, is to identify a problem through data analysis, determine a root cause, put a team together, and develop a solution.
Great. And as far as the developing the risk management harm reduction strategy that you're talking about, the controller mentioned that you said this has been pushing this for 6 years. Is that what I heard?
On the risk management system, the data system.
Not the strategy.
Not the strategy, but it's more the data system, right? Where it would have more of a robust component to it, where it's really getting into risk, not just workers' comp,
right,
but it really looks at risk management.
And so where are we on the data system?
We are addressing it, and part of that is determining the needs of that system. So the systems that we use currently, IVOS and then the medical liaison system, they're used for tracking and documenting injuries, but they're not used for risk management or injury prevention. Some specific areas that we would include in our accident investigations for our supervisor would be, was there determination if this accident was preventable or non-preventable? If preventable, what action was taken? Was there follow-up? Was it effective? Those things. So those are in place. They're part of our project sheet to go out to be implemented, and we have timelines on all those topics. So that's where we're at with it. We've met with other entities, again, and looked at their accident investigations, and there's some good things that we're going to implement for our department.
Is it the same thing like with the fire department? I mean, you need to change the system a little bit to be able to capture more fields of data?
Well, yes, we have some of the same challenges the fire department has in funding, systems, and personnel. The system that is currently in place, IVOS, is a good system for a lot of things, but we're trying to figure out how we can get that system to talk to ours or get it to download into ours so we can get what we need to get relevant data to do some analysis.
Do you have a comment on
Yeah, I
that?
was just going to say, probably the primary difference between the two departments is that fire department had their own database that tracked, to a good degree, the cause of the injury. So they did have some data available. Unfortunately, PD does not have that same type of information available to them, and that was a big distinction between the two departments. One was a little bit farther ahead in that, in having something in-house.
And in terms of the timeline for getting that additional data, I mean, we talked about it a little bit, but
We're looking at 12 months to try and get all of our systems needs in place. Of course, depending on funding, depending on personnel, but that is our timeline, is 12 months for that.
okay. A few more questions, or you want to go back and forth?
No, go ahead.
Okay. The finding 16 talked about the LAPD not having implemented the comprehensive department-wide health and wellness program and having poor participation. I know that we have the My Healthy Lifestyles Wellness Program is available for members now. What is the enrollment in that program, and how is information being disseminated throughout the department?
I don't have, do you have numbers on that?
I don't have the numbers.
We don't have numbers on enrollment in that program, but we can get back to you with that.
Okay. I mean, and obviously that goes to, I guess, answering the finding 16 and how we get to a solution there. the controller talked about on-duty sports activities. Is there a plan for addressing that?
Yes, there is a list of sports activities and locations that are approved for injury on duty should an employee get hurt participating in those activities. We are taking a very hard look at that right now and revising that. We're trying to get some numbers as to which activities cause the most injuries, and the chief of police is going to look at that very soon and make a determination as to what that list should include and not include. So yes, we're looking at it very hard.
And a question for the controller. The audit compared 32 claims per 100 employees versus Sacramento's 19 claims per 100 employees. When looking at cities to benchmark against, how did the sort of the other factors of policing take? How were they taken into effect, like violent crime statistics, use of force incidents, and other types of things that you might expect an LAPD to have a higher incident rate versus not that Sacramento's a cow town, but versus a smaller town?
I think one of the things that we try to do is, and it's always difficult when you're doing benchmarking when you're looking at the city of LA. We're so much bigger geographically. We have a bigger workforce. That's why we got it down to getting it to a basis that we can compare across all. We did not do it based on crime statistics or what the police were involved. We did look at those cities where we're looking at police departments, not necessarily, we weren't looking so much in comparison with sheriff's department, knowing that they handle more of the jails and the detention facilities, which has a different thing than just more patrol, where more of the focus is on patrol operations. So
We also looked at California only because of the work comp
worker comp
laws in California are very different. Each state sets their own laws. So we just looked at California cities. And it was based on size of the city.
Thank you.
All right, thank you. Can we move on to finding number 4? And when does the department anticipate the review will be completed?
We're hoping to have that done within the next 6 months.
Okay. And that's the same goes for updating the policies and disseminated it throughout the department?
Yes.
So in 6 months from now, or from when you started to?
6 months from the date of this report, which would be...
We have a due date of October 31st internally.
Okay, thank you. And on finding 5, does the department anticipate that the risk management and harm reduction strategy will be fully implemented?
Well, I don't know when we can consider it fully implemented. I will tell you that the risk management division is up and
Running?
almost fully staffed.
Okay.
We have our problem-solving teams out there meeting with experts, identifying solutions. We have an analysis and evaluation section that's looking at all the data, looking at trends and where we need to impact the most. So the strategy is out there and it's being worked on, or the processes are in place. One big thing that we are still working on is the risk management coordinator at the geographic areas. Because of staffing, what we're looking at is piloting 3 divisions specifically and placing a risk management coordinator in those divisions and trying to identify the best structure.
Is that because the 3 divisions happen to have the most number of injuries, or how did you come up with these 3 divisions?
One does happen to have the highest increase.
Can you say
in
which one
IOD.
it is?
Hollenbeck.
Okay.
And then we have Rampart and then North Hollywood division. Are the 3
North
divisions.
Hollywood, huh?
Yes.
Why North Hollywood?
We wanted to try something geographically away because they're different than what's in Central Bureau, just to see what the impact would be of the risk
But
management.
does it have anything to do with the number of injuries that are being reported in North Hollywood?
Not specifically, no. But it also has to do with people that they may already have in place to act as a risk management coordinator. Again, personnel or staffing is an issue. But we're going to pilot those 3 divisions as far as the structure underneath the risk management coordinator and see what structure is most effective, and that's the structure we would hope to push out department-wide.
And do you have timeline by which you want to do this?
Well, the
Did you say you were fully staffed now? And up and
almost
running?
fully staffed. There are a couple, I would say, 2 positions that we would still need staffing for. But other than that, we're up and running, and we are going out there. And in fact, tomorrow we're meeting with the risk management coordinator at North Hollywood Division, and to give them some guidelines and expectations on what their new role would be.
So you mentioned Hollenbeck, North Hollywood, and what was the third division?
Rampart.
Ramp.
Yes.
In finding 7, since the audit, what improvements has the department tracked, whether the employees have completed the required training, safety trainings, since the audit?
Was it PTE issue?
Yeah, but that's not the tracking. That's actually rolling out new training.
We have talked to PTE, which is Police Training and Education, about rolling out new training, keeping track of training better, having training that emphasizes safety in addition to procedure. So we have had discussions. What concrete improvement have we made? I can't say we've made any concrete improvements, but we are in the beginning stages of implementing some sort of safety training for the department.
But you haven't started that yet. You're
Well-
talking to PTE to start helping
We
you with
started
that?
in,
The training itself has started. So right now, we're in the stage of developing phase 2, which is, so phase 1 was a video that goes out, it's viewed on the lands, and it's the facts of workers' compensation. Well, how to report a claim, what's presumptive. It's an educational video. The second phase that's rolling out, that's being developed through PT, is more emphasis on safety and prevention. So it's not about the form filling or how to file a claim. It's about safety awareness and prevention, so we don't have to get to the form filling stage.
But you currently don't have a way to track just to figure out how many employees have taken the required
The
safety
system is in place, LMS. It's all automated, and the issue is when you have training that's not part of LMS, and let's say, for example, a divisional training coordinator provides training to a group of people, and then that doesn't get inputted manually into MS. But
So you have no way to track that type of training?
well, correct me if I'm wrong. I believe training division audits that or tracks that.
right, there are training coordinators in every area, and either training division or PTE, I can't recall, can track who's taken what and who needs to take what. So yes, there is a tracking system. I can get back to you on that because I'm not in the weeds on that particular tracking system.
And in finding 9, so have you reactivated the divisional and the Bureau Safety Committees?
Yes,
I
we are.
believe you mentioned that during your presentation. I just wasn't sure if it was,
Right. By July, our timeline is by July 31st to have all the committees up and running. Whereas we had some committees that were active, we had some committees that existed but were inactive. By July 31st, we hope to have all the safety committees up and active.
and then my last question is for finding 13. How long do you think it's going to take the department to review their orders, policies, and procedures and ensure that it's consistent throughout the department?
We're looking at 6 months, so that's October.
End of
Also
October
October
31st.
Yeah, October.
Okay. All right, I think that's all I had. Do you have any other questions? All right, thank you very much. Madam Clerk, I don't have a card for anyone who wishes to speak in public comment, so having no cards for this item, if there is with no objections, I'd like to move to
Question,
note and file item 2.
before we note and file, can we move recommendation 1.2, which was the one, there was a policy question on, move that to Public Safety Committee?
Sure. This is on item 2, correct?
On item
It's
2,
1.2.
item 1.2, which was the question about was the recommendation, manage workers' compensation prevention by regularly reporting to mayor and city council on workers' comp statistics, prevention efforts, and results of corrective actions. And the controller's office had one idea about it, and the department had a different idea. And so my recommendation is that we move that question to the
Public Safety Committee.
Public Safety Committee to have it fully vetted as a policy question.
Great. Did you get that, Madam Clerk? All right, so noted. So the rest, I'd like to, with your recommendation, I'd like to move to note and file item 2. No objection? Great. Thank you very much. So there are no cards for public comment, so I move that this meeting adjourn.